Hi, this is Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University. And I want to provide another quick answer to an important question. And this one is, what should we have learned in the first year of COVID-19? I say this is the first year because in retrospect, the Chinese believe that the first case they had was November 17th, just exactly a year ago. So I'm going to list the 5 things that I think we should have learned from this pandemic going forward. First, it's important to prepare for a global pandemic. Most of our preparedness has been around hurricanes, wildfires, earthquakes, localized disasters. We really weren't prepared for a global pandemic that disrupted the global supply chain. Second, it's important to understand the interrelationship of different public health issues. You know, we study heart disease, we study diabetes, we study racial and socioeconomic disparities. But this pandemic has really reinforced the interrelationship. We can't hope to be healthier if we don't address all of these issues. Next, it's important to use clear and focused language. I think one of the mistakes we made in this pandemic is we weren't clear in what we were talking about. A case could be anything from someone who was about to die to someone who had a positive test. A case should be someone with presumptive symptoms and a confirmatory test. A presumptive case is someone with the symptoms but no confirmatory test. A confirmatory test without symptoms should be reported as a positive test. But by using simplistic language, calling everything a case, it became very difficult for folks to understand what was really going on. Second most important thing I think we learned from this is that we have to do the things we know work. And in this case, I think what we did wrong is we didn't test. We needed a test early on so that we could find folks that were infected and isolate them. And at the same time, quarantine their contacts. By not doing a good job in quarantining, we simply lost the opportunity. And the most important thing I think we learned from this is that we understand it's important that future public health issues not be politicized. I don't think anyone, Republican, Democrat, Libertarian, Socialist, I don't think anyone thinks that anyone benefited from the politicization of COVID-19. And I don't blame politicians for this. I actually blame us. One of the things you learn in higher ed is you can't hold someone accountable for something they haven't learned or haven't been taught. So I think we have an obligation to help the general public better understand science and the uncertainties of science. Because if we don't do that, we will be constantly fighting this battle. As widespread and deadly as COVID is, and as where it falls in the list of the most lethal pandemics in human history, as bad as it is, it could have been a lot worse. If we don't learn these lessons, I think we are going to suffer repeated challenges like this. Obviously, these are just my thoughts, no one else's. If you have any thoughts or comments on these, please let me know. I look forward to hearing from you. Thank you very much.